I'm waiting for 9 o'clock.
Oh, okay, we got
Yeah,
it's getting there.
almost there. There it is. Okay.
Ding, ding, ding.
All right. All right, like to call this meeting to order. Review of the agenda, anything? Everybody good? Okay, approval. Oh,
You know what? I forgot to send you guys to print the minutes off. But I sent it all, sent the minutes in the email, but do you guys not have a copy of it?
I made a copy.
You did make a copy, so. Hopefully everybody reviewed it.
and
I
if-
always print out the agenda and the minutes, but not the financial statements.
Got it.
Yeah.
All right, well, if we're comfortable voting on it, we can, or we can always defer to next week, so. Or next month, not next week. Oh my
I
God.
move we approve the minutes of the June joint meeting.
Second.
All right, all those in favor say aye.
Aye.
And we don't have Ann yet, right? Okay, thank you. All righty, anybody for public comment?
No.
No, okey dokes. All right, vacancies.
So social worker position closes today, the relisted. We'll get hopefully get a personnel candidate
Has
list.
there been any applicants to that?
I don't know until they kick it to me. They keep that quiet because it's internal listing, so I'll get the internal listing first. And then then it'll go external and I'll get another listing or a full
Gotcha.
listing then.
Okay,
So I can see who's internally applied for it today, hopefully this afternoon. Peer recovery coach is on board. She will begin on Monday. And officially she'll start as an HHR associate or as a temporary appointment. And then we'll transition her over to a full-time DOP recognized position once the DOP finally comes through with recognition that health departments are allowed to have peer recovery support specialists. So-
now, was that funded, that's funded by a grant
That's
though, right?
totally-
So then what
completely grant
happens
funded.
if the grant goes away?
Well, then she understands that
Okay,
that QRT team
yeah, you're right.
is what she's employed for, and that when if the QRT team or the QR team is disbanded, then so
Okay.
will that position.
Got it.
She understands.
Any questions on the vacancies or positions filled? One. All right. Going on to our financials with Charlie.
Good morning, everyone. All right, so we have the May and the May report. So that's 92% through the year. Bank balance, $509,000. We're in compliance with the reserve requirements in excess of $197,000. Looking at the month of May alone, revenue, $74,000. We're gonna reduce that by salaries and wages of almost $83,000. Operating expenses of $18,000, giving us a deficit for the month of May of almost $27,000. Fiscal year to date, as of May 31st of 2023, revenue of $1.2 million. We're gonna reduce that by salaries and wages of $925,000 and operating expenses of $319,000, giving us a deficit of $11,700 through the month of May. Comparing that to the budget, revenue is 11% below what we budgeted. Salaries and wages below what we budgeted by 16%, and operating expenses above what we budgeted 31%. That's mainly travel. And there's a lot more travel this year than the last couple of years because of COVID. Some increased office expenses due to new equipment and vaccines. Accounts receivable, approximately $82,000 as of May 31st. Average days to pay, 42. Of the $282,000 of receivables, approximately $155,000 is West Virginia Treasury. That's about 55% of the balance. Any questions on the month of May?
That West Virginia versus other seems to be getting more,
Yeah, so West
like sort of
Virginia,
less West Virginia, more other.
oh, more other,
Yeah,
yeah, so there's,
Two reasons for that. The grant department at West Virginia is finally fully staffed.
Okay,
And also at the state aid office, it's also fully staffed, so they're turning around those types of things
Okay.
much quicker than they previously had when we were waiting for
okay.
$230,000 and $280,000 and $290,000 than before. But also, we have a lot more clinical side billing too, a lot of insurance, a lot more
Okay.
insurance.
So this is
billing.
insurance, it's not like
Right.
debt or thing or
No,
kind of
a
stuff.
lot of it's clinical billing, clinical insurance billing and things like that, so.
Alright. And.
Any questions? Are we still on May? So any questions?
No,
We need, I guess, a motion to approve.
I
May.
move we approve the May 23 financials.
second.
And all those in favor say aye. Aye. Opposed, none, that passes.
And then on to June, so these are the preliminary reports for June. Bank balance, $488,000. That is in compliance with the reserve requirements in excess of $147,000. For the month of June, and we do expect these numbers to change a little bit, especially the revenue, maybe a little bit of the operating expenses. So for the month of June alone, revenue, $147,000. We're gonna reduce that by salaries and wages of $119,000. And operating expenses of $20,000, leaving us a surplus of approximately $8,000 for the month of June. Fiscal year to date, through June 30th of 2023. Revenue, $1.4 million. Reduce that by salaries and wages of $1 million. And operating expenses of $339,000, giving us a deficit of $3,300.
So I quickly ran the numbers this morning, QuickBooks, the actual numbers, still not official yet because we're still waiting for one more grant to be billed that can't be billed before the 14th of July. That's still for fiscal year 23. And we're at about 8,800 or 8281 positive, net positive for the year so far. And probably looking at about 12 to 15,000 on that grant. So we'll be hopefully somewhere around the 15 to 20 to $25,000 surplus.
Which I think is right about a mark,
For this
right?
year. Nah, it's a little low.
Little
But
low?
we did spend a lot more on vaccines, a lot more on travel this year than I had budgeted for, and even I missed that a little bit. Underestimated both of those, but to speak about vaccines real quickly, that's money that was spent in fiscal year 22, which will mostly be realized as income in fiscal year 24. So our fiscal year 23 moving into 24.
Receivables gone up a lot.
Mhm.
So.
But yet the average days to pay has come down slightly. But yet the biggest category is the over 90 days at 40%. What's mostly in that over 90 days?
So most of it is West Virginia, that's $80,000 of it. And then probably just some medical billing we're still waiting to get in.
Yeah.
Just a remainder, but yeah, so just go over receivable numbers real quick. Accounts receivable is about $320,000 as of June 30th of 2023. Average days to pay went down 40 days. Receivables greater than 10%, we have 2. So usually we only see West Virginia Treasury in there, but right now those numbers include West Virginia Treasury and NEHA. West Virginia Treasury of that 240 was $48,000. $163,000 is West Virginia Treasury and $85,000 is NEHA.
That over 90 days, is you think anything's in danger of getting written off?
From West Virginia Treasury, most likely not. Those are pretty.
Yeah, you said it was-
But the medical, that might be a Gina question.
No, because typically 6 months is typical for if it's not billed. They have to remember this is billed
Right.
This is billed, we just have yet to receive it. So after 6 months, if we haven't received payment, then we start chasing them. But
Okay.
it's if you don't bill it before 6 months, you won't be paid on it.
So the medical part gets very complicated. Brandon can talk about that, and it's a whole subspecialty, medical billing. And so there's the bill, so let's say you bill $1,000 for something, then your insurance allows 600, so that becomes the maximum if we have an agreement, which we do with almost, so that becomes, so we write off that 400, and then you need your 80% from the patient or from the insurance company and 20% from the patient, depending on their deductible, whether they've been their copay and all that. And this is going to be a big number to look at as we go forward, because years before we really had no medical billing income, and there are a lot of people who think of this as a free clinic, and there are some services we offer free, but if it's not one of those specific programs, it's not free, and it's and that's going to, and certainly we don't want to turn people away, but it's going to be a big issue, is that we don't want to give away too much services. But then if we have nurses and we sitting here and no one's coming in, someone comes in and say, well, we'll see you weekend.
But we can't, like, if somebody doesn't pay their copay. Or whatever remainder between billing, like what the medical insurance bills and then what they're responsible for, we can't go after them though, can we? Like, we can ask them for the money, but we can't.
Well, there are ways, and we have to clear this with, you know, our council and all that, but people who are indigent, that's one thing, and so there is a sliding fee, and there are federal poverty levels and all that that we follow, but, people can't simply, refuse to pay, you know, but that becomes a problem, but it is one of the ways that a few years ago, the state was saying that's how health departments are gonna make ends meet. And, you know, that's one where the private, corporations, including places like Shenandoah Community Health, which is federally qualified health center, means they get subsidized, for several $1 million a year, but people have to meet their guidelines, and they can go after them for money.
We haven't had any real struggles with that. Typically, the process is we get payment up front for almost every service whenever we can. If there is any type of financial difficulty, then we approach that using the guidelines that we have from the federal government based upon, you know, their income and poverty level, and they attest to those types of things before we do that.
So
We haven't had a lot of trouble here.
typical, you know, specialty thing would be travel vaccines. People
That's
are
a good
going
one.
overseas. That you know, is not the same as someone getting their childhood vaccine. It's a whole different issue. And so we expect those people to either pay up front for their hundreds of dollars of vaccines, or have the insurance say, yes, they will pay for it.
Yep.
And that sometimes creates delays because people come and they're leaving the country in a few days. And it's like, your planning didn't, you know, but
Test that.
the front desk people always bear the brunt of it.
They do, but let's give credit to the front desk and to Dr. Reading for setting up a very efficient and effective system for administering these travel vaccines, which are certainly optional. You don't have to go to Ghana if you don't want to. You know, it's not like being in the Marine Corps or something where you're sent there.
I would like to point out, so if you look at the May's summary, the key metric sheet, the other receivables as of May 31st is $127,000. As of June 30th, that is $71,000. So there was $56,000 that we collected between May and June. So even though that 90 days creeped up a little bit, overall, that down significantly.
Good, that explains how the days, the average days to pay dropped from 42 to 40. Yeah, that's good.
And hopefully, if we provide more services, the account receivables will continue to go up, just as long as we keep.
A lot of people like
Yeah,
John,
right, yeah.
And Gino did talk about how West Virginia Treasury is getting faster now that they're fully staffed. I took a look at their average day to pay, and right now it's 60 days for them.
So is this average days to pay, like of all the payments you received last month, this is the average days it took to pay, or is this average days outstanding?
It is an overall calculation, so it's not based month to month, it's of the whole history.
It's all outstanding.
It's outstanding.
It's all outstanding.
That's
So
actually
the average
pretty good.
days outstanding.
About
40.
yes.
Oh, okay, sorry, I think I misunderstood the question.
Yeah. One of the things I'd like to also point out is the substantial increase in clinical services fees year to year. And also compared to previous years, and the previous year's average was about $220,000 on an annual basis. And a lot of that is because we've been much more diligent in billing for services, for clinical services, and billing insurances for clinical and for reimbursement for clinical services that we had not been doing in previous years, and certainly not when Dr. Reedy here first came here. That was like one of the very first things he said. He's like, why aren't we billing for clinical services as much as possible? And we've been able to turn a lot of that around in the last
Do
year.
we do that internally or do we source it out?
So we've done a lot of it internally, but we did source out
That's what I
the
thought,
COVID
the
bill,
COVID
the COVID
ones,
bill
yeah.
because it was so overwhelming.
But we didn't
it
just-
was well
that was
worth,
just for
it
the
was well
COVID.
worth the 7.5% that they charged for it, because otherwise we would have lost about, I don't even know, probably about 60K.
Overwhelming because of volume or just
Volume.
administrative?
Volume, and also because rules had changed midway through, so you had a lot of rejections and had to refile for them, and and having the front desk be able to do their job, seeing patients and being friendly and polite, and having to do that at the same time, it was very, very difficult. So we outsourced that, and yes, we did pay a fee for that, but we would have probably lost, well over 40, 50, maybe even $60,000, if we didn't farm it out. It was well worth it.
Sounds like it.
Any other questions? Thank you, Charlie.
Thank you. Have a
Um,
great day.
Thank you.
Didn't see it, Charlie.
all right. Agency activity report. Is Gillian still on?
Gillian is on. Gillian, would you like to speak?
Yes, so for the environmental report today, the last or most recent sanitarian that we hired did not work out, so we have recently, re-advertised that vacancy. So, the next training starts in September, so we're hopeful to have somebody hired before then. The numbers this month were very good. The sanitarians completed about 226 total inspections or site evaluations, including over 80 routine food inspections. And then I think the only other thing that I have to report about is at the end of this month and the beginning of August, two of us will be traveling to New Orleans for the National Environmental Health Association conference that is covered by one of our grants for travel. We'll be presenting at that conference as well, so.
The big number here is the dramatic increase in the number of food inspections compared to the 7-month average, but also compared month to month here. So give a lot of credit to Gillian and also the sanitarians for actually getting out into the field. It helps that Savannah is now completely trained and 100% able to get out into the field. So
How many do you have?
3 sanitarians and sanitarian supervisor. So we'd like to have 4. That would be ideal for a county our size.
And the fourth was the one that didn't work out.
Right, and that happens.
Okay.
So
Gillian, the national standard, if you would, for sanitarians for our county, what would that be?
What was your question again, Dr. Reedy?
What would a national benchmark for how many sanitarians we should have?
So we actually, with 4 sanitarians, we do meet that national benchmark as far as being able to conduct the minimum number of food evaluations, with one of those sanitarians being solely working in the food program. So I don't know that they have a benchmark set for how many sanitarians you need for a well and septic program, because that's a lot more variable. But the one for our food program is dependent on the number of establishments, the risk categories that they're in. So how many times that they need to be inspected per year, and how many facilities should be assigned to each sanitarian. So 4 meets that national benchmark.
Thank you.
Mhm.
Any questions? Rep preparedness, Mason.
Just, 2 quick things. So the first one, and I don't remember the exact day, I think it was Wednesday or Thursday last week, we had a gas spill incident. So somebody was driving around the side of the building there, and they had spilled, I guess a can of gas or something, or at least from their car. And it shot into the vents through the HVAC throughout the entire building. So the entire building smelled like gas, even though we don't run on gas. So we went outside, we called maintenance, they came by. And what ended up happening is they just ended up putting, I think, sawdust down on the gas.
Kitty litter.
Yeah, to absorb it. So, they kept saying it smells like gas, and I was like, Gina said too, we don't run on gas, we didn't know where it was coming from, but.
This county would actually love to run on gas if we could.
Right.
Gasoline.
Yeah.
Yes, and it was gasoline, yeah, it's because the generator is not, it's
Right.
So they just spilled it in the wrong spot.
I spilled it to the near the intake.
Yeah, right in that intake area.
Murphy's Law.
So that was,
If you're gonna spill it, might as well spill
yeah,
it.
so that was.
No one was trying to burn us down, were they?
I don't think so.
Just have to ask.
I don't think, but if, yeah, maintenance, then we would have had to call the fire department, but.
Yeah,
we
Paul
didn't
came
get to
out,
that
and Paul
point.
came out and did a really great job and cleaned it up, found it and then cleaned it up.
Yeah, so we were good on that, and then just yesterday we went and set up, we have a 15 by 15 tent. And that was that would take about an hour and a half, which is a big improvement from the last time we tried to set it up. Last time we tried to set it up, we did it with emergency management. It was cold, it was windy, and we couldn't really. I don't think we followed the directions properly, so it was kind of a mess. But we successfully got it up this time.
And the tent is used,
It's for,
Right.
the tent would be used for whenever we go to the fair, and also, would have been really useful to have for COVID going out in the field, because you have like the window, you can put in the, panels, yeah, on the sides.
So the
The
state
deal with it.
purchased that and a generator and
HVAC,
Yeah, so we
the
could hook up,
exchanger
yeah,
and
and a trailer.
big trailer it goes in for every county.
It's actually really nice.
Which was last fall, I guess, that we were told to come pick it up and say, what?
It's actually really nice too.
Yeah.
so for the fair, we're gonna try to set up the tent and the AC, the generator.
You could
Yeah,
use it as a
have-
drive-through for cars if you needed it.
Yeah,
The hope is it's being not used.
that's the, yeah.
But we practiced putting it up so that we're prepared when it's time, when
So
necessary.
it's air conditioned in the.
It can be air
It
conditioned,
can
yeah.
be air conditioned. That's our goal for the fair, is to be able
Assuming
to.
that's all our CARES money, that's CARES,
A good bit of it, I'm sure.
IRA and everything else.
ARPA.
ARPA,
Yep,
really.
state ARPA funds, COVID funds,
Sounds
all
like
of
it.
it.
Sounds very, yeah. Sounds suspicious, and you get a trailer, and you get.
That's exactly what I was thinking.
Well, they just let us know that it was ready for pickup, and we ended up having, voters from Berkeley County pick our, like,
Drop
and
ours
we ended
back.
up, yeah, dropping it off.
Yeah. Thank you, Bill.
Yeah.
He helped.
He
Oh,
helped.
but, yeah.
He did.
Dr. Reedy.
Dr. Reed, of
Yeah.
course. Down there. What are you doing cool next month?
What am I doing cool next month?
Aren't you doing something cool?
Or
Or is it in September? When are you going to Santa Barbara?
Oh, Long Beach, that's in November.
Okay,
Oh,
We'll talk
That's
about that
the
later.
emergency management conference. Last year that I went to, it was in Savannah, Georgia.
They always go to the best places.
This year it's in,
Really,
this year it's in Long Beach.
tough life.
Must be nice to be 24 years old and travel
Be
all
able
over
to
the
give-
country.
yeah, yeah. Yeah, conferences runs about 8 to 4, sometimes 8 to 6, so you still get the
You get a little
evening
bit.
in Long Beach, yeah.
Nice.
Mitigation group you're working with.
Yes, we're doing the hazard mitigation update for like the entire county. And so emergency management's like the key partner, and they've hired a contracting group to update the hazard mitigation plan, and then we provide input, as well as like all the other county agencies.
So this is a 6-year,
It's a 5-year.
5-year plan.
5-year.
So it's to
plan.
get FEMA funds
For
that
FEMA, yeah.
could be used to offset. There's a complicated formula, but it actually is important in
Yeah,
the
it's
different
really important
government.
for-
The elected officials all need to be involved too, because they need to show that there was interest.
Clinical?
So, Dr. Reed, would you like to do that, or I can easily do
You
it
can do
too?
that.
We're running consistently with what we have in the previous months. Did see a lot more family planning this past month. If you've never met Leah, I know Ann is personal friends with Leah, but Leah's our nurse practitioner, our family practice
Oh, is she
Uh,
here?
nurse practitioner. And
Yeah,
Yeah.
just
Oh, okay.
recently got married.
Yep.
And Leah's doing great work. She has tremendous rapport with patients and it's really nice to have her here. So, but otherwise, we're really pretty much running on the same numbers that we've done in the past, and we're still doing strong on the, so the other vaccines, that is, I believe, a lot of the travel vaccines. It's interesting that a lot of the county residents and even Berkeley County residents are coming here for their travel vaccines because it's not as easy to find them
Mhm.
as you might think. And we have a good bit of them on hand, so,
We even had a Washington County resident
wow.
come because they couldn't get in and we were much cheaper than the other places, not for the vaccine cost, but with things like the yellow fever vaccine, only specific places can give that.
Yep. We're one of them.
So the next step with our new midwife nurse practitioner, gynecologic nurse practitioner, is to get her credentialed with private insurance companies so that you don't have to be indigent to. So the family planning program invests in breast and cervical cancer screening programs, there's an income. But there are other people who would like to come, but often you can't really work with the insurance company if you're not in plan. So getting her credentialed takes several months, but that is the plan because we've not had that in the past.
And there is a demand for it.
There is a demand, so hopefully we will see those numbers rising.
So the breast and cervical cancer screenings and things like that is in demand, and then as soon as she's credentialed with the insurances, I think we'll be able to raise those numbers too, and that'll be really, really great.
We don't do mammograms here, though.
We do not, but we refer for them.
Okay, so you just get the
Just like a
prescription or
private-
whatever.
Right.
Prescription or
and
whatever,
So
yeah.
so whether it's private insurance or the others, we refer to a participating practitioner. But-
Is she here twice a month?
Some months, yes. And hopefully, and she's willing to do even 3 times a month if we can get to the point where the local demand is there. So that would be great. She's really dynamite.
And from the nurses, she's just fit in fine.
Perfect, yeah.
So,
It's always great when you hire the right person.
She's a product.
Yeah, she's excellent.
she's a local.
And she's a little, yeah. Otherwise, we're right in line with the numbers and it's nice and steady. And then the childhood vaccines obviously will start to rise,
Mhm.
July, August, September. And if you didn't know, if you're not hooked up to our Facebook page or any of that stuff, then you may not have seen the announcement that we will be we will be doing extended hours several times a week leading into the school year for people who, can't take the day off to get their children vaccinated for school vaccines. So we'll be available in the evening.
Nice.
Yeah, we'll repost that too once it gets closer.
Yeah, we just want to put a quick reminder out there and then we'll remind again.
All right, epidemiology.
All right, so no presentation this week. I'm just gonna kind of talk about what I've seen in the last kind of month and a half.
Good, so we don't have to walk away scared like we did last time. Every time I saw a wild animal.
I was scared, but
We took our dog's food inside.
Right.
it's important things to think about.
Yeah.
But I definitely will say with my job, you do kind of get to see the scary side of things. Which is good, being aware of it, but also, you know, it's a tamper on some things. Like pools.
Don't
Anyway.
talk about pools, just keep on going.
So some of the cases that have kind of been coming in the last month and a half. So we had multi-drug resistant bacteria. That's kind of an up and coming public health problem. It's going to be something that is becoming more common towards the future. That's just a type of bacteria that's resistant to some forms of antibiotics. It depends on kind of its class. We have hepatitis B and C. That's kind of normal. We've seen normal levels for that for this month as well. We've seen you're gonna have to correct me if I'm wrong, Dr. Reed, Haemophilus influenzae, which is a type of bacteria that causes different types of infections, but it's preventable by vaccine, which is why it's reported. The big ones that we've kind of seen this month are enteric diseases, which I kind of mentioned last month. When it starts getting warmer out, they start becoming more popular because it's right in their multiplying temperature, so they grow quickly. One focus is the parasitic enteric diseases. So we've had some cryptosporidium, which is most commonly spread through water, drinking, and recreational. Drinking is usually when something goes wrong though, or if you travel out of the country. Cyclosporidia, which is consuming food or water that's been contaminated with feces that has the parasite in it. And also Giardia, that's also most commonly linked to water, such as like rivers, lakes, pools,
Bovine.
hot tubs, all that fun stuff.
And just beautiful crystal clear spring water or
Yeah.
river water.
When I lived
It
in,
looks clear.
when I lived in Hawaii, you never went into the fresh water because it had Giardia in it because of the downflow of
Yeah,
of
that's
from
exactly.
animals.
Stuff.
Stuff.
These bacteria that are resistant to standard treatment like antibiotics.
Mhm.
Is one of them that flesh eating thing that was reported a few years ago? There was a bacteria that was,
So there are a number of different bacteria that are getting that sort of name,
yeah,
but it's a common one is a strep, but all of the microorganisms have resistance to different chemicals. So when we know an organism, we say, oh, this generally works, and we know that so our local hospital lab does susceptibility testing, and they come out with this many of our strep viridins were sensitive to this. But when you start seeing things that used to be sensitive, just we'll talk about MRSA, so methicillin, and those class of penicillins. When the staph on our skin causes an infection, usually you could just give lots of different antibiotics. But as those antibiotics no longer work, and methicillin specifically, then you have MRSA or methicillin resistant staph. And how dangerous that is, it's different for everything. So it is something that's tracked, and certain common things like E. coli, which are from the enteric or your gut, common bacteria.
MRSA is skin.
A skin one.
And it's related to malaria. It's in that family. Is that?
No,
No?
it's so the Staph aureus is just a regular bacteria that many of us have on our skin, and some of us it's resistant, but if you're not infected with it, because your skin prevents it, you're fine. But so any kind of microorganism can become resistant, and that becomes a concern. But the concern is a lot of people are exposed to antibiotics frequently, and skilled care facilities and hospitals become the special problem, because you're then likely to, that becomes the predominant organism that's around. And then the person that happens to acquire it while they're in that facility, they get one that's resistant. So urine infection, so think of a nursing home patient with a bladder catheter. Well, that's a tunnel that infection can get in, so you want to minimize the use of those. But if you
Like
get
a root canal is also a similar tunnel, but
Yeah,
I'm sorry.
so any
Entrance.
anything that, overcomes the normal resistance that,
Mind boggling.
then, you're susceptible to an infection. So usually we think of urine infections as they're pretty easy to take care of, or lung infections, antibiotics work. But when they don't work, that's a problem, because some things like urine infections can rapidly become body-wide sepsis. And so in nursing homes, that's especially a concern. So that's one of the areas when there's certain bacteria that are resistant to multiple drugs. And they're very specific, confusing definitions of what you do.
Well, that's the age-old debate about oversubscribing.
Yeah.
Yep.
And the balance between trying to stimulate the immune system and trying to, attack it with pharmaceuticals.
Right, and so there are some infections that are most likely just regular viruses, like common colds or earaches and things like that, that are going to go away. Antibiotics won't help because they're viruses, but you can't 100% be sure it's not. And so you say, well, we're just going to cover our bases, but then so changing that behavior, which is partly the practitioner's behavior, but also largely the community's behavior. Say, I came in here and spent this much money, and you just said, go home and take a Tylenol, so it's a difficult issue, but it's one that needs to be addressed in many parts of the world where you don't need prescriptions to get medications. Then they use, the filter of the practitioner is not there. So you just go to the drugstore and get your antibiotic for whatever, and drug resistance can be a big problem.
Mexico.
So it's an issue that only comes up when suddenly you have a lot of cases of it, and that's not been an issue lately here, but you're always right on the cusp, and we're the ones that are supposed to investigate. When we get a report of one, we're supposed to look and see, is there a thread here that connects it, and so far no.
That's why they also stress the importance of finishing your antibiotics.
To take another round.
Yeah. Because what you don't kill with the beginning doses is what continues to along. And so the last little chunk, I guess the subcategory is bacterial enteric diseases. Some Campylobacter, which is most commonly linked to undercooked or raw poultry. Shiga toxin producing E. coli, which is the most common type, is O157. It's also found in the intestines of animals. And then salmonella, which is foods that's contaminated with feces, and also with people coming in contact with infected animals in their environment, most commonly chickens. Yeah, so make sure you wash your hands. And that's it.
All right, so we're not eating anything after we leave here. and-
Well,
So the dogs all got taken food in, yeah, we're not.
Cook it all.
It's like very overdone.
Cook your chicken and eggs properly. After you've handled, you could give this speech, well, after you handle the chicken, the raw meat doesn't want to be touching prepared foods.
Oh, correct,
Keep
yes.
them separate and wash them. You don't store the chicken
Over the
above
lettuce.
other things, because you don't want
Yes.
water dripping down. These are things that the sanitarians look for when they do inspections, and if they see the chicken up here and it's dripping onto other stuff, that's a big deficiency. It needs to be corrected at the moment they're there. But this also is stuff for home as well.
And these things happen. A lot more than you might think.
Motivation is that if we don't put our meat that we need to, defrost, if we don't put it in a container and it leaks. So the motivation is like one of us yelling at the other,
Yes.
like,
Why did you do that? Why didn't you put it in a container and cover it?
Right.
And which comes first, the chicken or the egg?
Right. All right, thank you. All right, Dr. Reedy.
So not a lot of new information, the opiate issue remains prominent, just so the billions of dollars nationwide that are coming from the pharmaceutical companies because of the law settlements, every state has a mechanism for dispersing that. And West Virginia has I think it's West Virginia First Foundation, I forget what the name is, but there's a law that specifically describes how there's going to be distribution, and there's a committee that has different people appointed either by local entities. So the three, I guess Wednesday, there was a meeting from the counties and municipalities from, I think, 5 or 6 of the local counties that met in Berkeley County, and they elected a member from this region, and that's Tim Zija, who's the head of the Day Report Center of the Berkeley County government, and so he's been well experienced. So he's someone that he knows about this stuff, and he's willing to learn, and he's strong and tough, and he will present the needs of the community. He's very much involved in the interface between incarceration versus non-incarceration ways of working with people. So I think we'll be well represented.
Is this a paid physician?
I don't know that.
I think only the executive director is paying.
For the
For the
full state?
foundation.
Okay, and this is all the opiate money, right?
Yes.
Said that, okay.
Correct, yeah, and so where that gets dispersed to, I don't know. I hope we will be able to get some. Monday, our first employee in that program will be starting, and there's another person who's going to be part-time working with us, and she's very experienced, works in many of the counties, and so be helping guide us. We need to get more formal agreements with the referring agencies, which would be emergency medical services, 911 center, and law enforcement. Law enforcement can give us names of people and addresses. They are not a healthcare entity, so they do not have to abide by HIPAA or other medical confidentiality, because they're not meeting people for medical reasons, they're meeting people for others. The 911 center, the addresses are publicly available, but you don't know who the person is. Our goal is to try and reach the survivors of a overdose or poisoning. Most of these people did not intend to take too much. You just don't know what's in, how much you're getting. The terminology is confusing. Poisoning is clearly somebody that thinks they're taking one thing and instead it's something else. That's a poisoning. But the emergency medical services, different jurisdictions interpret the confidentiality laws different. It was just one of the laws about whether they can, without written permission from the person that they're treating, whether they can refer information or local interpretation from our attorneys has been that we cannot. So there are other ways you can get that, but we do want to work with them. Some of these people are really ready to start seeking assistance, and that's our goal, is to try and get them in. It will not just be people who have almost died from an overuse, but others that will want to be recovery coaches to try and help get them services. And then we're going to be looking at providing some of those services. Our nurse Lindsay Gregory is finishing in 2 months. I think she'll have completed her doctorate in nursing as a mental health provider, and be able to provide that. We would need to be able to provide prescriptions for the buprenorphine or other medications. Though there are other places in the area that do that, access is not always that great. To do that, we would need to go through the state certificate of need, which is really, it's not so much the certificate of need like competition, but it's under the same office. And this is more a licensing to be sure you're meeting the criteria. So we'd have to have all these protocols. So Lindsay's working on that. But that would be something we would want the board to approve. And I think there's actually a line to do that. So that would be it does not require county approval like having a syringe exchange. This is an extension of medical practice. In other states, that is not a requirement to have a special license for the program. But so that's going to be, one of our ongoing focuses.
So if she had the doctorate in nursing, she can prescribe those?
She will be able to prescribe it. So you used to have to have the DEA license. You used to have a special license called the waiver. So you waived a requirement, and that required some extra training. I had that waiver. She could have gotten that waiver. A few years ago, as a nurse practitioner, she would not have been allowed in West Virginia to prescribe that, but now it's available. The DEA this past winter got rid of this waiver requirement, meaning any practitioner who's allowed to prescribe controlled substances. So I can prescribe, all sorts of narcotic pain medicines without any special. Well, I just get that in my DEA license. But the buprenorphine or Suboxone, one of the brand names, is less problematic, but you had to have a special license to do that. The feds got rid of that. So in theory, it should be easier to prescribe, but in West Virginia, you still have to get this special state license for your organization, which is fairly burdensome. But burdens are okay. We'll work with it.
What we're here for.
I'd like to get rid of it, but this is the landscape now, so
Yep.
we'll work with that. So I may ask next month for more formal action by them, or if we can discuss. And I'll get you stuff in writing about what this is.
Thank you. Okay, thank you.
A couple things. I'm not bringing it to the board this month, but I was discussing things with the sanitarians. One of the things the sanitarians brought to my attention was that the uniform stipend is the same for all employees. Sanitarians are required to have additional footwear that other employees are not required to have. Whether they're getting, I don't get into the mud puddles. I don't need boots like that. I don't need, non-slip shoes and things like that when I go into certain restaurants that require it. but the sanitarians do. So I will probably ask for a change in the stipend system and increase the stipend for sanitarians so that they have some type of footwear stipend on an annual basis so that they can, something like, maybe $150 a year per sanitarian. So not that much, but enough to defray some of the additional costs that they incur because of their position in the office. So I'm listening.
Any update on the status of who the county commission is going to appoint as the liaison to this board?
None at all. I don't know anything like that. I wish I did, but I don't.
Okay.
Yeah, I think it's on the agenda, or I think they have it scheduled for next Thursday,
So
in which,
it may be happening. I don't
yeah,
know who it will be though.
and our illustrious Ann Smith has.
I think he's talking about the ex officio.
Oh, the ex officio. Oh, yeah, I'm sorry, I thought the open position.
I left Claire on here and Dr. Reedy asked me to. I said, but technically on the county website, she's still there. So
Right.
that's why I left her there.
Okay. All
That's
right.
the only reason I left her there.
Yeah, it's gonna be my next
I would-
question. Wednesday.
If you don't mind my interjecting, I would suspect that the county commission is still trying to determine who the fifth commission will be. They may hold on until after that before they move forward on the Board of Health issue. But, I truly don't know. But that-
If they succeed in appointing somebody, because if they don't, they just have to go forward as four until November 24th.
We haven't reached that bridge yet, so
Yeah.
we're hopefully they will be able to agree on someone.
Yeah, good luck.
All right,
I don't have anything else to add.
Yeah.
It's
Next.
summertime. Go enjoy your
all
summer.
right, next meeting is August 11th. So we'll see everybody then.
All right, I move we adjourn.
Second.
All right, all those in favor, say aye. Aye, we are adjourned.
9:51.
This our